Hey everyone, welcome to today's webinar. My name is Jennifer Anderson, product marketer for Truven's MarketScan portfolio. We're pleased to have you attend this event to discuss unlocking value with Truven, data-driven insights for digital health solutions. I'll spend a few minutes introducing you to our webinar platform. This webinar is browser-based, so if you disconnect, click the link you received via email to rejoin the session. If you'd like to ask questions, you can use the Q&A widget on the platform. We will try and get through as many of your questions as we can once the discussion has ended. Please use the help widget if you experience any technical difficulties or require any more assistance. You can also use the related content box to access any additional resources. Today's webinar is brought to you by MarketScan, a Truven data solution. I would now like to hand things over to Jim, who will kick us off with presenter introductions. Jim?
Great, and thank you, Jennifer. And thank you to everyone for joining us today. Just to run through some quick introductions here. My name is Jim Holohan. I work in product strategy for MarketScan. So I'm focused on our non-life sciences businesses, which includes payer providers, consulting, employers, as well as digital health organizations as well. And really in my role, helping organizations to identify data analytics and benchmarking opportunities leveraging the Truven data set. And before I pass to Zainab, unfortunately, Ben Sanders wasn't able to join today due to some unforeseen circumstances. So it'll be Zainab and I presenting today. Zainab?
Thanks, Jim. My name is Zainab Sabliwala. I work as a senior analytics specialist. I've been with Truven for over 15 years. And I work really closely with clients like yourselves, other healthcare tech companies, directly with employers and health plans to really understand their data, help see the value of our analytic enrichments for different types of use cases like measurement strategy, pop health, value-based care, and more. So look forward to the discussion and any questions you might have. Thank you. And I'll hand it back to Jim.
All right, great. Thank you, Zainab. So let's take a look initially here at our agenda for today's call. We have 4 main sections to go through. First, we want to walk you through how Truven is currently helping digital health organizations and introduce Truven to this group here today. Second, we want to walk through how MarketScan is currently helping organizations demonstrate the effectiveness of the program. The third, Zainab will speak to how our health insights and services organization are helping digital health organizations demonstrate the product impact. And then in the last section, we'll talk about our use case with Lantern Care and some of the work that we've done and some of the work that we're currently doing with Lantern Specialty Care. And finally, we'll wrap up with a Q&A session at the end. All right, so let's take a little look here at Truven. And the organization, Truven, is one of 5 business units under the Merative umbrella. So Truven is a platform offering real-world data amongst many other offerings, helping clients along and throughout the healthcare ecosystem. We work with employers, payers, providers, consultants, life sciences organizations, brokers, and health tech/digital health organizations such as yourself. Today, we'll focus mainly on the MarketScan data on the bottom right of the visual here. And we'll also talk as well about health insights under our analytics arm, as well as our measurement strategy under services. At the bottom of the slide, you'll see the depth, breadth, and reach of Truven in the healthcare ecosystem, working with 40% of the Fortune 100 employers, as well as 7 of the 10 top US payers as well, just to name a few. So dive in a little bit here to MarketScan and how we are sourcing the data, because I think that's a really important part of our story. This slide is really meant to demonstrate how we source it at a high level and where it comes from. So over 350 large self-insured employers and over 40 health plans use Health Insights, our enterprise-wide employee health population solution to help manage their populations. Starting left to right here, we're receiving, fully adjudicated closed claims from these organizations that are patient level from our diverse pool of contributors. This includes eligibility data and medical claims data as well. The data is then compiled and standardized for each of our employer clients to help them better manage their employees' health. And then for all the contributing organizations, employers, and health plans, the data is standardized, curated, and QA'd. Once the data has been identified, the data becomes MarketScan. During the process, as you can see along the bottom of the slide, we pick up additional data elements, including encounters, pharmacy claims, hospital admissions, discharges, clinical findings, and worker productivity, just to name a few. All of these components are included in the MarketScan databases. So the left-hand part of the slide was addressed mostly in the prior slide, but I really wanted to focus the attention here on the right-hand part of the slide. We have three main core claims databases in MarketScan. We have commercial, Medicare, and Medicaid. Of the core databases, commercial is the largest, and we've recently seen a significant uptick in Medicare Advantage lives in our Medicare database as well. Both of these two databases, as mentioned before, are sourced from our over 350 large employers and 40 health plans. Medicaid's a little bit unique in that it's sourced from state Medicaid agencies, for which we have about 7 to 12 contributors at this point. Beneath the core claims database, we have many other specialty curated databases. Our health and productivity management database looks at short-term disability, long-term disability, as well as workers' compensation, capturing the indirect costs of healthcare. We also have health risk assessment and benefit plan design databases. For lab, we've seen a nice uptick in the number of lives in our lab database with our recent growth in Medicare Advantage lives. And we also have dental, mortality, and SDOH databases as well. In addition, for MarketScan, we have the ability to link to external data sources, which we'll talk more in more detail about as we talk a little bit more about how MarketScan's helping digital health organizations today. We also have a current partnership with Veradigm, where we have an off-the-shelf linked solution that's linking our claims data with Veradigm's EHR data. In particular, I think, outside of how we're sourcing the data, which is very unique, there are other unique attributes of MarketScan we just wanted to highlight here. And these attributes are differentiators and important to many of our digital health clients as well. So it's really starting left to right, data completeness is key. MarketScan is a patient-centered database that integrates medical claims, inpatient, outpatient, pharmacy claims, and eligibility files at the patient level. Another good thing about MarketScan is we also include non-claimants in there to help with your numerators and denominators for your analysis. MarketScan reconciles all the events of care at the patient level, linking the full patient journey, and also providing a strong backbone for data linkages. This is a differentiator from some of our competitors, in which the individual encounters sometimes show as unique lives. We have everything rolled under the event at the patient level. MarketScan follows employees and their families while they're under the same employer or contributor. As a result, the average patient in MarketScan is in MarketScan for over 4 years, denoted here in the second column, really allowing for strong longitudinality and to gain a better understanding of the whole picture of a patient's health. As a result of our sourcing and having fully adjudicated closed claims, MarketScan identifies true direct costs of care, with over 90% of the financial variables included being actual paid amounts, representing both the patient and the insurer paid components. This makes MarketScan a great database for contracted rate analysis, pricing, and reimbursement use cases. And finally, through our vast number of unique data contributors, MarketScan has representation across all 50 states and all ages. We're able to follow patients across insurance plan changes during their employment with our data contributors, allowing organizations to really get a full grasp and understanding of the healthcare trends for patients in the United States. Next, I'll pass over to Zainab to tell you more about our program evaluation and measurement strategy.
Perfect. Thank you so much, Jim. So that was a great overview of how valuable our MarketScan data asset is. And what I'm going to talk about, throughout this presentation is our complementary offering of analytics and services, as Jim mentioned earlier, right? So we serve a lot of clients like you, and the main challenges being that data quality and standardization. So the first thing, kind of our foundation, is really understanding healthcare data and what's typically considered non-standard healthcare data as well. So that we not only make sure that it's quality, because we have the relationships with many of the carriers and the vendors carrying this data. We also ensure that it's standardized, it's meaningful, and that we understand the data so that we're getting the right data that we need to be able to measure the outcomes. So we're very thoughtful about the types of data we include, ensuring that it's going to help us get to the point of measuring outcomes and reporting on insights. And then there's a piece of integration, right? So having just programmatic data, right, is really meaningful, but having that integrated holistic data set takes us to the next level, right? There may be situations where we're not engaging the right people. There may be situations where people have already had this care and we don't have the whole set of information. There may be other instances where there's a person that's just simply not going to participate. And it would be great to understand that information so we can really hone in where we can make impact and show value. And then there's the component of a biased evaluation, of course. So we provide that non-biased view. We understand data, we understand analytics, and we can pair that with the benchmarks that Jim is talking about to really show the full picture of, starting with engagement. Are we getting the right people? How are we measuring this? Are we identifying the right KPIs? What are the behavior changes that are expected? And ultimately, what are the outcomes we want to look at? And we can really do this all along, at every step along the way. We don't have to wait till the end to measure this, right? And it's really beneficial to be able to do that, because we might need to change things or add new data sources along the way to make it more meaningful, to make it more accurate, and get a better understanding of what's going on. And so we really work as a partner throughout that process. In addition, I just want to mention, with our robust analytics and benchmarking capabilities, we can help show the value prior to implementing the program as well, right? Having that fully holistic data set helps us understand what are typical patterns, where are there opportunities, how can a certain program improve from what's happening today within your employer group or clients that you're serving. And I look forward, I'm going to talk to you a little bit more about that later today in terms of use cases. But for now, I'll hand it over to Jim to talk about MarketScan and measurement strategy.
Great. Thank you, Zainab. And we'll come back to Zainab after this section. So we want to walk through how MarketScan is helping digital health organizations today. So the flexibility in how MarketScan can be deployed is really part of the story here for our digital health organization partners. Organizations can license MarketScan data. They can opt for MarketScan benchmarking, or we have the ability, as previously mentioned, to link external data sources to MarketScan. And I think it's important here to note that each of these three options are currently being utilized by digital health clients today that are leveraging MarketScan to help them to demonstrate the effectiveness of their program. So if we start at the top with licensing MarketScan data, this becomes a really great option for organizations who want to leverage their strong analytic capabilities to analyze claims data, create their own benchmarks, and or compare it to a similar population. Clients have the option of licensing any of our full data sets, or they may be more interested in selecting a subset of the data to best meet their needs. MarketScan benchmarking is another option that allows clients to receive analytically ready-to-use benchmarks for their projects. These clients typically have a specific use case and prefer benchmarks versus creating their own, allowing them to move faster. We have an off-the-shelf offering option here that we'll talk a little bit more about, as well as the ability to provide custom benchmarks from a MarketScan database. And the third option here for deployment is linking to MarketScan data. And this is a newer offering for us. So our MarketScan data is tokenized through a third party and can be linked to external data sets. This option provides clients who are interested in analyzing their patient's claims experience and healthcare journey outside of their program. And we'll talk more about each of these options over the next few slides. So licensing MarketScan data. Clients have the option of licensing any of our databases, starting with our core databases, commercial, Medicare, and Medicaid. We also offer the option of licensing subsets of data if it better meets your needs. Subsets, for those wondering, are typically condition-specific and or geographically defined, and we work with our clients to help them to establish and set up their subset. We deliver MarketScan, whether it's a full license or a subset of data, via our cloud-based platform, MarketScan Workspace, which is supported by Snowflake, providing quick and easy access to the data. With industry-leading closed claims data via MarketScan research databases, our workspace environment helps enable organizations to analyze large amounts of data with high performance, scalability, and confidence. Clients who license MarketScan or a subset of MarketScan get access to all the data fields available. In the commercial database alone, there's over 115 different fields and columns in order for your analytics team to have the option of creating their own benchmarks and really optimizing their use of the data. This includes the actual financial variables, which include allowed amount and net pay. MarketScan also offers the flexibility to provide updates on a monthly, quarterly, or annual basis based on your needs and use case. In this case, for our digital health organizations, we see most commonly the commercial database being a primary interest, and whether that's a license or a subset. And an example of a current use case that we're working with an organization with is allowing them to create their own financial costs and utilization benchmarks, and looking at the related cost of a specific medical condition tied to their program, to provide them an opportunity to see what that experience looks like outside of the claims that they currently have. And we also have organizations using the MarketScan data as a comparative population to their program's population as well, to see how they compare. MarketScan benchmarking is the next option here. And as mentioned, we have a couple different options here. The most common are our reimbursement benchmarks. Reimbursement benchmark provide estimates of reimbursement rates by procedure code and DRG and the type of bill based on the MarketScan commercial database. Whereas reimbursement benchmarks are more of an off-the-shelf option, we do provide clients the option of leveraging custom MarketScan benchmarks. We're able to create benchmarks for clients leveraging the necessary fields available within MarketScan based on their needs and use case. Digital health clients like this. They like this option for several reasons. First, they may want to leverage benchmarks based on the fields in MarketScan that include the actual financial amounts. So if they want to look specifically at allowed amounts, they typically are interested in seeing this at a market level, and we're able to drill down to the metropolitan statistical area, or MSA. They may want to see how the rates compare across different sites of service, right? So we have benchmarks in there for inpatient, outpatient, ambulatory surgery center, and office visits, just to name a few. We also have the ability to drill down by provider specialty and also by plan type, which is another field included in MarketScan. Our team, under the Truven umbrella, we have access to nosologists and medical coders that can help you and help our clients validate the procedures included in the analysis. In this case, it's most common for the benchmarking to be done on our commercial and or Medicare databases. And a use case, which we'll talk about a little bit later in our final section example, is organizations looking to create sort of an apples to apples comparison using benchmarks for common orthopedic surgeries, comparing price by procedure code across different sites of care in different geographies and markets. The third way that we're helping organizations today is by allowing linking to the MarketScan data. So through our partnership with Datavant, we're also allow for MarketScan to be linked to a variety of data sources. As long as outside data sources are also tokenized through Datavant, as a first step, we can run an overlap analysis of tokens between our data sets to better understand the number of overlapping patients. Through our collaboration with Datavant, we're able to keep patient identities hidden through tokenization of the data. For those that may not be familiar, ensure tokenization, a unique anonymized ID or token is created to replace the variables that eliminate or reduce the risk of re-identification of the patients. Digital health clients choose this option because of the data completeness of MarketScan, but also because of the inclusion of medical claims. We have the medical claims and eligibility files integrated, as well as you won't see any missing financial variables in MarketScan. And if you're looking to demonstrate the ROI of your program, measure the effectiveness of your program, that becomes a very important factor in your analysis. The MarketScan commercial database is what's most commonly used here as well. And as I said earlier, this allows organizations, particularly digital health organizations, to see how their patients are navigating sort of the healthcare ecosystem and their patient journey outside of their own claims experience. So as you can see, we have a number of different options for deployment of MarketScan that have really resonated with digital health organizations. And based on your use case and data needs, we can potentially help your organization demonstrate the effectiveness of your program as well. So with that said, I'm going to pass over to Zainab to talk a little bit more about our measurement strategy.
Wonderful. Thank you, Jim. And so kind of to add on to that, right, I'm going to show a few use cases, some of which definitely integrate MarketScan to Jim's point as being really critical to getting that aspect of what's going on outside of our direct claims experience. And in some cases to have the volume to be able to do that, right, to create that matched cohort. So one of the things I want to start with is just how we, our approach to measurement strategy. So we work with different types of clients on measurement strategy, whether it's directly to an employer, whether it's partnering with digital health solutions like yourself. And I'm going to show some examples of that in a few minutes. But this is just an example of really kind of thinking about the process end to end. So defining that engagement, identifying the KPIs, tracking the outcomes. And, I don't want to go through each of the examples, but in this case, we're talking about a diabetes drug refill program. So the ultimate goal is to increase people who are getting their diabetes medications, ideally, mitigate disease progression, reduce adverse events, and really just improve quality for those patients, right? And so what we want to do as we're, along the way is make sure initially we have the right data sources to be able to define that, right? Identify what KPIs are important in terms of adherence. What other secondary KPIs do we want to look at that might help us show things like disease progression changes and a reduction of adverse events? And that's where all of our analytic enrichments come into play, where these are kind of pre-created clinical content that you can leverage to define these KPIs or adjust as needed. But ultimately, we don't want to get down, past a year down the road and see that this program didn't really work the way that we wanted to, right? So kind of doing this early on from the point of preliminary analysis all the way throughout to kind of track, understand KPIs. We're doing text reminders. Is that working? Are we engaging the right population? Is there a certain profile of people that are engaging? And is that the right people that we're trying to engage, where we're going to see the most value? And so we can, having the experience, having the integrated data really helps us kind of identify these things early on so that we can actually in real time make changes to help you make changes to that program. And then we can continue to monitor that in the data through our analytics and our insights and all the way through the outcomes. So I'll talk about some of the use cases that we leverage, that we've done with our clients today. And this is just a few examples. But this first one is looking at our experience directly with a large employer. So they had an MSK program really developed to treat those MSK conditions and help with MSK pain. And here we were able to create a baseline group as well as measure the baseline group as well as the intervention group. And it was found that in fact, the cost increase of those non-participants was significantly more than those participants once we got to the point of intervention. And specifically, the invasive services spending increased significantly more for non-participants, right? Which was really the goal here, like that they're getting the right services, they're getting less severe services. And overall, we can look across the distribution to see for invasive services, imaging, office therapy, what that distribution was for the participants versus the non-participants, each of them compared to that baseline population. And the point here is, we work directly with an employer on that. We could do this on behalf of a digital health solution for multiple employers, adjust those KPIs. But this is one example of a type of evaluation that we might do. And this next example is working with the digital health solution and actually doing an evaluation of this program. So Personify's program was meant to really emphasize benefits navigation and ensure that patients are using outpatient care, proactive engagement, really steering them to more efficient use of the healthcare system. And here, there's a comparison. We actually leverage that MarketScan data asset that Jim's been talking about, which was really important. And this is where we can identify matched cohorts, right? We can look to make sure we're looking at a similar risk profile of patients, that we have enough volume, that we're looking at age, gender, geography, disease severity. We can look at a variety of adjustments to make sure that we're matching that cohort. We're properly evaluating this group of engaged participants against that benchmark, so we can get a true sense of what's working and how it compares to the market. And in this case, it was seen that there's a lower cost in those engaged participants versus that matched cohort in the MarketScan database, as well as an increase in more of an outpatient services and less inpatient services within the participants, which was the overall goal of the program, was that more efficient use of the healthcare system for patients with these conditions. And then this last slide is kind of a combination of both. So this is where we worked with an employer client and a lot of the digital health vendors that were supporting them to really, and this was also an MSK program, to really improve throughout the point of engagement all the way to measuring outcomes, right? So this was a great example of that iterative process. Understand what's working well, what's not working well at the beginning, making those programmatic changes, and then continuing to measure and track iteratively throughout until it really became a well-oiled machine. There are great successes that have been shown from this program in terms of both quality and cost, and reduction of injury rate, and that those results are continuing to show themselves. And so that was really like a great win-win situation where everyone was at the table. Everyone wants this program to work, so we were able to work together to leverage the data and analytics foundation to measure everything appropriately, and let the data tell us what those iterations should be programmatically as well, and continue that feedback loop multiple times. And this sort of resulted in application, a win for the Coop Award in 2023 and honorable mention in 2024. And so that was a great example of kind of that end-to-end process and really making the most of measuring that program and the value that that could bring. And that really just brings me to, our role here, right, is we are experts in data collection, transformation, building intelligence on top of that data. So understanding the right data, making sure it's quality data, making sure it's trusted data, and then making sure we have these enrichments that help us more easily identify KPIs and how to measure outcomes. We have all this pre-created content to make this easy and to add to not only cost outcomes, but qualitative outcomes and other related KPIs that might be meaningful here. And kind of this is really where we shine. And so partnering with with a healthcare data experts who really understand healthcare data and how it ties into benefit strategy can be really meaningful here. So while we can take that off your hands, really allows digital health solutions like yourself to focus on what's really important, which is that effective engagement and outreach directly with the patient so that we can make those changes in healthcare. And we can continue to help measure that for you so we can show that value. With that, I will go ahead and hand it over to Jim to talk about Lantern Health.
Great. Thank you, Zainab. And thank you for walking us through those specific use cases. And so we wanted to take an opportunity here to talk a little bit more about a specific use case that MarketScan's been working on for the last few months with Lantern Specialty Care. So in this particular use case, we really are looking at regional price variation across markets, which, to the surprise of probably no one on this phone call, is something that has plagued the U.S. healthcare system for a long time. And so as an organization, our goal is to help our clients to make the best and most informed decisions, right? So, understanding in this case for Lantern Specialty Care, the variation, not just in the price of the procedure, but also in the pricing of the individual components of the procedure, right? So we looked at 6 orthopedic procedures, which we'll get into more detail on the next slide, and some of the underlying components of those surgeries as well, to really help them to understand the price variation across settings, across markets. And this also, having this information allows your organization as well to start to differentiate your program from others as well using data. And I think, understanding price variation across different sites of care is key in this particular case. And we know calculating ROI for healthcare programs is difficult. And some of it has to do with reporting, some of the obscure components of reporting, significant variations between the cost and quality of surgical care. There's a lot of common data flaws. I think Zainab touched on a few, but in this particular case, when you're looking at orthopedic procedures, deleted anesthesia codes, omitted implant costs, incorrect site of care codes, these all can distort the perception of current cost. And further challenges include inconsistent data from multiple partners, right? So building on what Zainab shared earlier, how do we address that, and how do we help use external data sources such as MarketScan to help you identify, what is a really good starting point, at least from a baseline standpoint. And so, we've seen regional price variation differ for a variety of reasons in markets. Some of it has to do with the market share on the part of the payers and providers. Some of it has to do with changing payment incentives and regional health policy. And really, we took a look at, differentiating the facility and the professional cost of these orthopedic procedures, and really understanding the negotiated rates of both of those components is really key, especially when you're looking at bundled rates. Obviously recently there've been many initiatives to make healthcare prices for healthcare services more transparent, to address the cost of healthcare. Many of those efforts now rely on providers or health plans to post accurate rates. And so there's some variability there with those types of data sources. And this is why I think for Lantern Specialty Care, MarketScan became a really interesting partner because of how we're positioned, right? Leveraging the actual allowed amounts to provide regional reimbursement analysis across the various sites of care that we mentioned in our benchmarking option prior on the MarketScan slides, to allow them to really optimize care delivery and their network optimization as well. So a little bit in here about the overview, some methods, and then I think some key findings here as well. So the six orthopedic procedures that we looked at collectively were knee replacement, hip replacement, knee arthroscopy, anterior cervical disc fusion, as well as gallbladder removal. And so what we wanted to see was how the pricing for those elective procedures varied across multiple sites of care and multiple geographies. So what we did is we deconstructed the surgical bundles into individual surgical components. And we'll get into a little bit more of what those individual surgical components were in our next slide, which addresses methods. But we were able to really do this well using the MarketScan commercial claims database. So we compared and trimmed the average price across 10 distinct different metropolitan statistical areas, allowing us to really look at regional price differences and identify, any behavioral changes in those particular markets. And not surprisingly, there's a lot of variation by geography and provider, with much of the differences based on, as we mentioned earlier, some of it has to do with market share, some of it has to do with pre-existing regional patterns of reimbursement variation. And then, the one constant I would say that we saw across the board here is we also incorporated Medicare fee for service in here to help with our sort of upper and lower limit setting. For every individual component of these surgical bundles, each component was well above 100% of Medicare across all the geographies that were studied. So again, this really allowed us to sort of set a baseline in this analysis to help with sort of this next phase. So from a method section, we looked at the individual surgical components being facility fee, physician fee, anesthesia, implant, and DRG. So we applied the same 5 components to each of the 6 procedures. And so to capture the adult population, we only focused on members or enrollees between the ages of 18 and 65. And given the population typically served by Lantern Specialty Care, we targeted specific plan types, excluding those individuals who were enrolled in HMO plans or high deductible health plans. In addition to leveraging the MarketScan commercial claims database, we also utilized Medicare fee for service to help establish cut points really on the lower end. And we also incorporated the national and monthly CPIU to inflate our nominal prices after calculating the trimmed averages, right? So we used a percentage of the MarketScan commercial claims database, like a percentile of the reimbursement as the high end. We used Medicare fee-for-service rates as the low end to establish those cuts points. And we only included the individual surgical components for which encounters in the particular MSA were greater than 30, right? Just to maintain a sense of statistical significance in the overarching analysis. So it's been an interesting analysis and study. It will ultimately culminate in a white paper that hasn't yet been released, but hopefully here shortly will be in the next couple of weeks. But we've learned a lot about the regional price variation for these 6 common orthopedic procedures. And ultimately understanding price variation by site of care is imperative to identifying outliers and optimize your network design. And what we found is that what works in one market may not work in another. And really, I think the message is don't guess, right? Know with certainty what is happening in these markets, right? The markets included, the 10 different MSAs that I mentioned, represent nearly 25% of the entire population for the United States. So we know market forces are driving most of the variation, and namely probably more around payer and provider market share than anything else. This analysis requires actual financial amounts from fully adjudicated claims. So this informs how we assign both our upper limits and lower limits, as well as trimming to make sure that the encounters included reflect standard care. So really, eliminating outliers from this analysis. Another finding is that implants are inconsistently included in the administrative claims. And this is key when you're looking at the full cost of a surgical procedure, because implants are not often captured in the overarching price of a bundle. So the components included in the bundle may vary by payer or provider, and make sure you clearly understand what's included and what's not. The implants can be very expensive, not surprisingly, particularly in the ambulatory surgery center. So that has to be a factor when you're looking at the sort of the total cost of care for any procedure, but particularly in these 6 common orthopedic procedures. The distribution of where the procedure occurred, not surprising given the procedures that were selected. The claims data in MarketScan's commercial claims database reflects the migration to outpatient over inpatient care for these 6 common procedures, but the pricing by site of care may not always fall the way that you expect. And so we noted markets where ASC rates were higher than hospital outpatient rates for some of these procedures. And it's not necessarily always the markets that you think it's going to be that are maybe known or notorious for being higher cost markets to operate in. So I think our overarching message here is know with certainty, right? We can help, through our data assets, through our services, to help your organizations make informed decisions. We'll include the final results of our work with Lantern Specialty Care in our final white paper. They've been a wonderful partner for us. Our teams work closely with Ben and his team. And unfortunately, Ben wasn't able to join today. But he's played a key role in this, and it's been a great partnership so far. So I will pass it over to Jen for the Q&A portion of today's call.
Okay, perfect. Thank you, Jim. So like Jim said, we'll now move into our Q&A session. And just a reminder for the audience, to ask any questions, please send them in via the Q&A box at the bottom of your screen. We've already received a number of great questions, and we'll do our best to get through as many as possible. So why don't we get started? Here's the first one, guys. We understand the benefit of having a data and analytics partner so we can focus on the impact. What are the efficiencies you bring over other analytics vendors?
Sure, I can take that one. Excuse me. So one of the things I would just say is kind of back to that initial point of ensuring we have trusted data quality. So our experience over decades of having relationships with a lot of these employers, a lot of these carriers, a lot of the point solutions, we actually have standard shell layouts, as we call them, because we've worked with them so often that we understand their data, we understand their quality, we have comparison points to make sure the data is coming in the right way. So that's kind of an initial efficiency. And the other thing is, like, in many cases, our clients might be your clients, right? So there might be a lot of overlap there and a lot of efficiencies gained if we're collecting data, and then we can have the right agreements in place, because once again, it benefits everyone to be able to show the most value of this, and that could help get closer to that piece of integrated data and getting that holistic view. And then, of course, I'll speak to Jim's part, but having that MarketScan data asset side by side to pair with a benchmark if you don't have the volume to create a matched cohort, to be able to do that really specifically to get that comparison really accurate so that you can measure those outcomes.
Great, thank you. Jim, I think this one is for you. Why did you exclude HDHPs in population to study for Lantern?
Yeah, it's a great question. I think, in our MarketScan commercial claims data, we have approximately 11 different plan types represented, right? And so when we started to work together with Ben and team from Lantern, I think, we put that in front as, okay, what plan types are you most interested in including, excluding from this study? And at the time, the thought was to remove the high deductible health plan patients, I think out of concerns about how it could potentially impact the regional pricing analysis. So it's a population that we did exclude. I think it's probably more of an example of our ability to adapt to meet what the customer wants, right? And in how we're looking at the data, what we're including, what we're excluding, right? So appreciate that question. And it was just one of two, HMO being the other, that we removed from the regional pricing analysis.
Great, thank you. Okay, here's another one. Can you tell me more about your MarketScan reimbursement benchmarks?
I'll take that one, Zainab. So I think when we talked about MarketScan benchmarking earlier, I referenced reimbursement benchmarks as our sort of off-the-shelf benchmark, right? And so reimbursement benchmarks have been around since 2012. And so we've been producing reimbursement benchmarks from the commercial claims database for a while, right? And they've been in the market, they're trusted. And what they do is they provide a market level view of the negotiated rates for that market. And they're aggregated at the procedure level. So inpatient, obviously at the DRG, we separate facility from professional for both inpatient and outpatient. Outpatient, right, with the variation in the types of reimbursement represented in contracting for outpatient, we have a couple of different grouping options that we include, right? So we include sort of this like fee for service view where it's line item by line item, all the way to sort of a case rate view at the primary CPT HCPCS code as well. So traditionally, reimbursement benchmarks have been used in preparation for managed care contract negotiations, but they have a multitude of different use cases when you really want to look at paid amounts in a market. And one thing of note for reimbursement benchmarks is that it not only includes benchmarks for the allowed amounts, right? But there's also benchmarks included for gross charge as well as for net pay as well, right? So gives you the full spectrum. But by and large, most clients are focused on the allowed amounts, right? And the various benchmarks there, the allowed amounts. But yeah, been in the market for a while and serve a number of different purposes.
Great, thank you. Okay, one final question. What are the benefits of using MarketScan versus other claims data vendors?
So I'll take that at least initially, and Zainab, feel free to add any color to this that you'd like. I think the highlights from our conversation today, one is the sourcing of the data, right? The representation of different plan types across the United States, the geographical representation. But I think for this group, most important are the fact that, our claims are going to have medical data in there as well, right? So if you want to see the claims in any of the ways that we talked about deploying the MarketScan data, that's going to be there 100% of the time, right? And the other piece I would say is the financial variables, right? Having fully adjudicated claims, actual financial amounts, is key. You're not going to run into scenarios or patients where there's a missing financial amount, right? So I think based on at least the work that we've done with some digital health companies, those are some of the things that differentiate MarketScan, as a closed claims vendor from some of our competitors that are in the market.
Zainab, anything else to add there?
It was summarized great, right? Like I just would like emphasize, that more holistic view, right? Kind of to what we were talking about before, having the medical claims, having the drug claims, having that integrated viewpoint to really understand outcomes, as well as the longitudinal piece. So if you're trying to understand, what happened 1 year out, 2 years out, we have that ability with MarketScan data.
Great. All right, and with that, we'll wrap it up. I'd like to thank our speakers today for their presentations. And thank you all for joining us today. You'll receive an email tomorrow with details on how to access the on-demand version of this webinar. Alternatively, you can also visit www.arena-international.com/events to watch it at your convenience. And please continue to submit your questions and engage with the interactive widgets. This event will remain interactive, even in the on-demand version. If there are any questions we didn't get to today, we'll definitely follow up with a written response directly. And thank you once again for joining us, and we look forward to seeing you at a future webinar.
Thank you.
Thank you. Take care.